good morning. I'm here with Dr. Enrique Grande this morning. We're here to discuss the letter to the editor he wrote in response to the EV302 trial. This was published recently in the European Urology Journal, and it described EVITA criteria, trying to identify patients who may not be optimal candidates for EV pembrolizumab. So welcome, Dr. Grande. Could you tell us a little bit about, how this criteria was developed and what specific factors you and your colleagues looked at and why you developed this criteria?
Well, I'm delighted to be here, Amanda. Thank you so much for the invite, and good morning to everybody. We discussed, when we say we, it was Amish Kamat, it was Alison Birtel, and we were discussing about the new, very exciting data about the EV302, the combination of enfortumab vedotin and pembrolizumab that is completely changing the natural history of our patients with metastatic urothelial carcinoma. The activity that we have in terms of survival, progression-free survival, responses, the complete response rate is amazing. It's amazing, and this is completely practice-changing. This is new guidelines, major guidelines, NCCN guidelines, ESMO guidelines are already updated, and this is the most recommended systemic treatment that we have. However, toxicity is there, and everybody with experience dealing with enfortumab and pembrolizumab, probably neurotoxicity, probably skin rash, probably some fear with the glucose levels, hyperglycemia, fatigue, etc., can appear. And this is something that it happens with all the drugs that we have in oncology, all the combinations particularly, and especially for a new drug families, a new family of drugs like the antibody drug conjugates enfortumab vedotin. So thinking about, are all patients candidate to receive enfortumab vedotin and pembrolizumab? If you read the ESMO guidelines, the recent publication by Tom Bowles and colleagues at Annals of Oncology, you can see that the vast majority of patients with metastatic urothelial carcinoma are fit enough to receive enfortumab vedotin and pembro. And we say vast majority. What does it mean, vast majority? Because vast majority means 100%. Well, probably we agree that nothing in oncology can be given to all patients. 10% are ineligible to receive enfortumab vedotin, maybe 20%, 30%. Let's take a look at what we have so far before the arrival of enfortumab to the field of first-line metastatic urothelial carcinoma. We were using Galsky criteria to identify patients eligible or ineligible for cisplatin, and we were also using the Gupta criteria to try to identify those patients, and you know Shilpa very well, to try to identify those patients that are eligible to receive platinum. And we were basing our practice on these criteria. Gupta criteria are exactly the same than EVITA criteria, enfortumab vedotin ineligible criteria. Well, it's a different story, different drugs, different perspective, different mechanism of action, different toxicities at the end. And the toxicity are the ones that are conditioning for the use of systemic treatment options. We are considering that our patients are ineligible to receive enfortumab vedotin if they are meeting at least 2 of these 5 criteria. Hemoglobin glycosylated above 8%, and probably you will say, I am not measuring the hemoglobin glycosylated in my patients routinely, so I don't have this retrospective analysis. Okay, if you don't have this measure, probably the glucose level above 150 in 2 consecutive blood samples 1 week apart can be considered that this is not a well-diagnosed or well-controlled diabetes. Grade 2, sensory or motor neuropathy, because of the neuropathy that can be induced by enfortumab vedotin. Retinal abnormalities, of course, most of them related with the diabetes. Creatinine clearance below 45 milliliters minute, and an ECOG performance status of 2. Why we are considering that the patient should be ineligible to receive enfortumab vedotin if they are meeting 2 of these 5 criteria? It's because each of these criteria can be, I think, potentially overcome with active measures. You can perfectly control the glucose. You can perfectly, and you can say, okay, probably the metabolism of enfortumab vedotin is not going through the kidney. The inclusion of creatinine clearance below 45 milliliters minute is not because of the metabolism. It's because of late condition related to the diabetes and controlled diabetes, not related to the metabolism of the drug. ECOG2, I mean, you need to meet, well, the patient needs to meet at least 2 of these 5 criteria to be considered ineligible for enfortumab. This is the consensus that we agreed. However, these criteria should evolve and should gain a broader consensus. So probably there will be a second version of this criteria, probably with a broader concept, and probably we are discussing if to have major EVITA criteria and minor EVITA criteria. So if the patient is meeting one of the majors, neuropathy grade 2, well, probably nobody will give enfortumab vedotin to a patient with neuropathy grade 2. Or, okay, you can have neuropathy grade 1 plus another one as a minor criteria. We still need to, the criteria needs to evolve, needs to get a broader consensus, and we are happy, Amanda. If you have any idea, please let us know.
Yeah, so actually, I'm actually interested to see, one of the ones that stuck out to me was any corneal or retinal abnormality. Specifically, what led you to include that in the criteria?
Diabetic retinopathy. This is what we are thinking. This is why nephritis, alterations in the creatinine clearance because of the diabetes, hyperglycemia not controlled, so the hemoglobin glycosylated, retinopathy, but oriented to the uncontrolled diabetes. This is what we are thinking of. ECOG performance status, once again, we can discuss a lot about the ECOG. The ECOG is useful or not? Of course it is useful. However, the ECOG can be deteriorated because of the aggressiveness of the tumor, how bulky is the disease, how many symptoms the patient have because of the volume of the tumor, or it may influence because of the comorbidities. So there are many things that needs to be fine-tuning so far.